Okay, so we're going to have a look, or start having a look now at the vertebral column and each of the vertebrae in turn. But let's just have a look now at some of the typical features of a vertebra itself, so we get used to some of the important terminology. So the typical vertebra is actually composed of two parts. It's composed of the body, okay, which we have here anteriorly, and then it's composed of the sort of vertebral arch, this area back here. So this sort of area here, referred to as the vertebral arch. So let's have a look at the body in turn, first of all. And typically the body is seen as roughly cylindrical in shape. And it's but obviously its shape can vary slightly depending whether it's a cervical or thoracic or a lumbar, but generally the body is sort of cylindrical in shape. The body has a flattened and roughened upper and lower surface, okay? So a flattened upper and lower surface. And that is roughened to allow the bodies to be connected to each other, okay? And remember, between each vertebral disc, between each vertebra, there'll be a vertebral disc. And that vertebral disc then is attached to the superior and inferior or upper and lower part of the body in turn. And that vertebral disc allows in part for the transmission of weight during the body when we're in the when the body is in the weight-bearing state. Now the anterior surface of the body, this front portion here, is generally convex from side to side. In other words, it's convex anteriorly. But the posterior aspect of the body, this posterior aspect in here, is often typically concave. So the anterior aspect of the body is convex, but the posterior aspect of the body is generally concave. So that's the body of our vertebra. And again, we can see our vertebral body here, generally cylindrical in shape. We've got a roughened superior and inferior surface, and that's the point at which the intervertebral disc will attach. We generally have a convex anterior element of the body, and the posterior aspect of the body is generally concave. So those are the features of the body of the vertebra, of a typical vertebra. Now we need to think of the vertebral arch. Okay. Now the vertebral arch is made up of two pedicles and two lamina. And let's have a look. We'll have a look at each of those in turn. So it's made up of two pedicles, two lamina, and from this arch, 7 different processes will arise. And those two processes are the two transverse processes, the two superior and inferior articular processes, and the spinous process. Okay? So let's have a look at each of those in turn. So the pedicles, here are our pedicles, okay? and they are quite large, broad bands of bone which project backwards from either side of the body at the junction of the posterior, so the junction of the posterior and the lateral borders of the body. So at the junction of the posterior and the lateral borders of the body, we have these two broad bands of bone which project backwards, and those are the pedicles. Now, each pedicle has a notch on its upper surface and a similar notch on its lower surface. So if we look at the pedicles sort of side on, these are the pedicles in here, the broad bands of bone which project from the body, and we have a notch on the superior and inferior aspect of the pedicle itself. Now, when the vertebrae are articulated together, these notches form a foramen, or a hole, which is called the intervertebral foramen. Okay, so an intervertebral foramen is formed when you have the junction of two notches from the pedicles. Okay, and it's through this intervertebral foramen that spinal nerves will pass to from the spinal cord. Okay, so if you can imagine, we've got one vertebra here. Here's the notch, okay, in the pedicle, and we have another vertebra on top, and here's the notch in the pedicle, and that area there forms our intervertebral foramen. So in a sense, when we have the next vertebral body on top of here, okay, with the notch in its pedicle, so this then becomes the intervertebral foramina, through which nerves can leave from the spinal cord. Now the lamina, okay, we've got the lamina in here, okay. These are two flat plates of bone which are actually now angled slightly medially, and they arise from the posterior ends of the pedicles. And they actually fuse together, and those lamina fuse together, and they then enclose the vertebral foramen. Okay, and this is our vertebral foramen. Okay, so our pedicles are two thick bands of bone which arise from the junction of the lateral and posterior aspect of the vertebral body, and then arising from the two pedicles and passing medially are the lamina, and together the lamina join and they enclose the vertebral foramen, which contains the spinal cord. So the two lamina then join in the midline, and when they join at the point of the junction, so arises the spinous process. Now, the transverse processes we need to have a look at next. Okay, we've got one on each side of the body. And they project laterally, one on either side, and they arise from the site of the fusion of the pedicles and the lamina. So we've dealt with the spinous process, we've got two transverse processes, but we also need to think of the two superior and inferior articular facets. Well, we're looking down on this body here, and you can see the two superior facets. And if we were to look underneath, or we can see it here in the lateral view, we've got a corresponding pair of two inferior articular processes, which will carry the inferior articular facet. So the articular processes project upwards and downwards, an upper and a lower on each side, and again they arise from the junction of the pedicles and the lamina. They have articular facets which articulate with the corresponding facets on the articular processes of the vertebra above and below. So in this example we would have another vertebra down here, and that would have a superior articular facet which would then form a junction with the inferior articular facet, and that then would form the facet joints that we have within the spine. The vertebrae in each region are in many respects very similar, so we picked out these very common features. And so a typical vertebra will give rise to pedicles, lamina, transverse processes, superior and inferior articular processes, which contain the superior and inferior articular facets, and a spinous process. So we've got those central features in mind, and we can think of each of those now as we start to look at the individual nuances of the different cervical spine regions, the cervical, the thoracic, and the lumbar.